While the Public Health Agency of Canada released a pan-Canadian action plan on antimicrobial resistance in June 2023, I am concerned that it lacks critical elements like concrete deliverables, timelines, ways to measure progress, and clear roles and responsibilities for each level of government. Without these elements, it is unlikely that this plan will result in any progress. We found that the Public Health Agency and Health Canada have been slow to implement regulatory and other changes, such as economic incentives, that could improve Canadians' access to antibiotics of last resort. Only 2 of the 13 new antibiotics used to fight drug-resistant infections are available in Canada, yet all 13 are available in the United States. To successfully fight antimicrobial resistance, Canada needs a full picture of antimicrobial use and resistance across the country, and a solid plan so that the right medicines are available and used in the right way to protect the health of Canadians. Let's look next at 2 audits that are closely related. The first examined the government's overall approach to modernizing its information technology systems, while the second focused on a specific program to modernize how more than 10 million Canadians receive old age security, Canada Pension Plan, and employment insurance benefits. In the first audit, we found that about 2/3 of the approximately 7,500 software applications used in the government were in poor conditions, including 562 that are essential to the health, safety, security, and economic well-being of Canadians. We found that a number of factors contributed to delays and cost increases. They include a lack of centralized leadership and oversight, a shortage of skilled people to carry out the work, and an inflexible funding approach. Every day that these systems are not modernized increases the risk that they may fail and that Canadians may lose access to essential services. Our fourth audit looked at the processing of immigration applications for permanent residence. We found delays, backlogs, and inefficiencies that affect the lives of people seeking to permanently make Canada their home, with the greatest impact on those applying to refugee programs. While Immigration, Refugees, and Citizenship Canada improved the time it took to process applications and reduce backlogs overall in 2022, it did not meet its service standards for prompt processing in any of the 8 programs that we examined. People applying to refugee programs waited the longest, on average close to 3 years. At the end of 2022, 99,000 refugees were still waiting for a decision on their application, and in the current processing environment, many will be waiting years. Although the government sets the target for how many permanent residents are admitted to Canada in a given year, we found that most delays and backlogs were caused by the department's own processes. For example, the department did not always process applications in the order they were received, causing older applications to get further backlogged, or routed applications to offices without considering their processing capacity. Although the 6 organizations we audited focused on the goal of assembling a workforce representative of Canada, that is only the first step. It is not enough to achieve the change needed to create a truly inclusive workplace. For that change to happen, departments need to actively engage with their racialized employees, to meaningfully use the data they have to inform decisions, and to hold their leadership accountable for delivering change. These issues are not new. If COVID-19 taught us anything, it is that being prepared and acting early costs less and results in better outcomes. I said it in March 2021, and I will repeat it today. The government should not need a crisis to understand the importance of acting promptly.